Hello, welcome to my channel. My name is Pauline RN. Today we are doing pharmacology. We are doing questions and answers directly from RN Nclex examination. Please hit the thumbs up. Please share my video and please subscribe. My first question is, what should you teach your patients about taking their medications at home? Correct answer: we'll teach them to read instructions, read their inserts, read their pamphlets, read labels that accompany the prescriptions. Some medications will say take medications before eating or after eating. Some medications will say take medications with food, which decreases gastric secretions, which decreases gastric irritations. Those are your correct answers for teaching patients taking medications at home. What are your wrongs in medication errors? What are your wrongs in medication errors? The correct answer: the wrong patient, the wrong dose, the wrong time, the wrong route, the wrong medication. Next question: what should the nurse know about medications before she administers them? All nurses, before you administer your medications, you should know the adverse effects, preparation of your medications. You should read your labels, read your expiration dates. Do not administer medications that are deteriorated. Check expiration dates, especially on those insulin bottles. Next question. You have an order to administer regular insulin and NPH. How would you administer them? R is clear insulin. NPH is cloudy insulin. Don't forget RN. You withdraw you will administer them in one syringe, not two separate syringes. First, you withdraw your insulin from the R button regular, from the R bottle regular. Then you withdraw your cloudy NPH insulin. Remember, RN, R first, N is last. R is clear, N is cloudy. That's how you would draw up your insulins. Next question. If you're administering medications for IM injection, if the doctor administers 3 milliliters of injection for a patient, how would you administer 3 liters of IM injection in the deltoid? Correct answer: usually 3 mLs would be for obese patients. you would administer 2 ml on one arm and 1 ml on the other arm. We're trying not to administer more than 2 ml in the deltoid. Administering more than 2 ml in the deltoid causes pain and irritation and distress to the patient. So your deltoid IM injection 90 degrees for 3 ml, you'd administer 2 ml in one arm and 1 ml in the other arm. Doctor wants you to administer scored tablet. You are administer 1.5 tablet. How would you administer that to the patient? The correct answer, you would administer 1 tablet, and it's okay to break a scored tablet in half. So you would dispose of half a tablet witnessed by a second nurse. Any medication you dispose of, a second nurse must be your witness, or else they may think you're taking the medication. So our scored tablets are breakable tablets in half. What do you know about enteric-coated medications? Correct answer, they decrease irritation in the stomach is the correct answer. What are the rights concerning medication administration of your patients? Correct answer, your patient has the right to be informed about their medication, about the purpose of the medication, about the side effects of the medication. Double check if your patients are allergic to the medication before giving it to the patient. If the patient is allergic, sometimes the patient forgets to tell us. Notify the doctor. The doctor will replace it for another medication if necessary. If the patient is allergic, put an allergy bracelet on the patient's arm and document the medication the patient is allergic to. Patient as nurse needs to know contraindications of your medications. So if your patient is going to get pain medicine or an oral tablet, just don't go to the bedside and say, Miss James, here is your tablet. That's very, very, very unprofessional. Sometimes we don't know if your patient is or is not a nurse or a doctor. Some people do not wish to state what their professions are. So you have to behave like a professional at the bedside. So before you administer the medication to your client, let the patient know the purpose of the medication, the side effect of the medication. Make sure you know of any allergies. Communicate to your patient. The patient has the right to know all about the medications before you administer. This will be an opportunity for you to do some teaching about medications. Okay. What do you know about administering patches to your patients? Correct answer. When you're administering patches to the patients, you clean the sites with alcohol. You clean the sites, you rotate sides. Just like your injections. Do not give injections at the same site. If you gave it in the right arm, give it in the left hand the next time. If you give it on the right abdomen, give it on the left abdomen. Rotate sides. pain patches, nitroglycerin patches. We'll have nitroglycerin patch. We'll have pain patches, fentanyl patches. So some medications do come in patches. For nitroglycerin, make sure you check your patient's blood pressure before applying a nitroglycerin patch on your patient. If your patient has a nitroglycerin patch on and the patient's blood pressure all of a sudden it becomes low, you will remove that patch from your patient. Side effect of nitroglycerin, it will decrease the blood pressure. Next question, who is responsible in court concerning medication administration? And the correct answer is not the doctor. The nurse is the only one who is responsible for any medication error in a court of law. Your doctor orders medications. Your doctor do not give the medications to the patients. So before you administer your medication, check the adverse effects of your medication, the contraindication, what it is for. If you have any questions, do not give your patients. Communicate with the doctor. Communicate with your pharmacist. Please hit the thumbs up button. Please subscribe to my channel. Please share my video with your classmates. My next videos will be on perioperative coming up shortly. Thank you.